All right, so we'll go ahead and get started. So first of all, welcome to the webinar today. Thank you so much for joining and taking time out of your day to join us for this webinar. We know that everybody's very busy, so we appreciate you taking the time to learn more about our new program, Target, Reach, and Engage Your Audience Using Healthcare Screening Kiosks is the webinar today. So for those of you who don't recognize my voice, this is Janet Torres with the Women's Choice Award. And today joining me for the webinar is Stephanie Myers, which is also on our team and oversees the digital campaigns and healthcare screening program for us. So welcome to everybody. We are extremely excited to introduce this program to you. As you know, we pride ourselves on being a true partner to our award-winning hospitals. The Women's Choice Award is not a traditional award company that gives you an award and you really never hear back from again. Our staff here year-round is always looking for programs that help our partners promote their Women's Choice Award, grow their admissions, and gain brand awareness in their communities. So we are beyond excited to introduce this program to you because it's going to help you with all three of those items. So without further ado, let's get started. So before we talk about the program, let's begin with the challenges that many of you may be facing right now. So for one, hospitals are always looking to grow admissions, but are limited on resources. So those resources could be time, it could be staff, it could be budget, the list goes on and on. We hear it all the time. Hospitals want to embark on more aggressive digital campaigns, but their staff is already stretched thin with other projects. Which leads me to the second thing. How do you reach people right in your community without spending all of your time targeting ads, geofencing, profiling, and so forth? For those of you who have done it before, coordinating a campaign takes a lot of work. Even before launching a campaign, a lot of time goes into research, data mining, ad creation, media buying, and more. And that's all before you can even pull the trigger on the campaign itself. The preparation alone can represent dozens of hours and thousands of dollars. In theory, it definitely makes a lot of sense to do it in-house, but once you take the hours and the manpower into consideration, you quickly learn that you're really not saving any money. Which leads me to the next bullet. Digital programs can be highly effective, but how many of you have a dedicated digital expert on staff? One of the most common reasons that digital campaigns fail is because the wrong people are in the wrong seats. Because of lean budgets, oftentimes one, maybe two people are doing all the work. They're planning the strategy, determining the target audience, creating the ads, managing the budget, adjusting it accordingly, and all of doing that while they're juggling their other marketing responsibilities. So realistically, that's a recipe for failure. And lastly, without a digital expert, you're spraying and paying. If you're not familiar with the term spraying and paying, it means that you're taking a shotgun approach and praying for good results. Sound familiar to anybody? So now that we've gone over the challenges, let's talk about the solution. With our digital program, you'll not only have access to a full team of digital experts, but a database of healthcare information that'll help you find exactly who you're looking for. So we offer a turnkey digital program that combines three components: brand awareness, email acquisition, and digital targeting, all in one campaign. So the first one is brand awareness. So you can leverage the traffic of over 3,600 Walmart and Safeway stores across the country to promote your hospital to those in your service area. So we have a database, or rather a network of 3,600 Walmart and Safeway stores, but you know, we understand that you don't want to reach everybody, so we can target right the exact Walmarts and kiosks that are right in your service area. The second component is email acquisition. This happens at the actual healthcare kiosks. Once your target audience has been identified, they'll go through the screening process and they'll watch a short video or a banner ad with the option to opt in for more information. What that does is it provides you a qualified database of leads that you can then follow up on. This avoids the once and done campaigns. I mean, a lot of us do digital campaigns, and you go out there, you do the campaign, and then it's over, and you really don't have a way of reaching back out to the people who clicked or the people who filled out something, or that's kind of what we call a once and done campaign. By having email acquisition, you can then have a whole new pipeline of prospects and qualified leads that you can continue that conversation with. And the third part is the digital targeting, which that happens out of store. So based on the campaign specific criteria that you give us and the audience, we'll find the exact person that you're looking for, and we'll serve them ads that get results. We can send them back to your website, we can point them to an online form, or we even have the option to do a click to call campaign for you. In this slide, you'll see how we tap into our in-pharmacy network and our healthcare database to reach your desired audience, and more importantly, prompt them to take action. So I'll turn it over to Stephanie so that she can review this deck with you.
Yeah, hi everybody. Thanks for joining us today. That's exactly it, Janet. This digital marketing platform is driven by two main channels, both positioned to complement each other and create results for your hospitals. On the left side, the in-pharmacy network of health screening kiosks offer opportunities for building awareness of your hospital, for providing education on your offerings, and it's all in an environment where consumers are actively engaged in a health-focused experience at the kiosk. And then, thanks to the rich data that's been collected over the years from the kiosk and other survey sources, we have HIPAA-compliant opt-in ailment data for about 25 to 30 million people across the country. And so for the outside of the pharmacy network, the right side of the graphic, we create precisely targeted online audiences for the service line you want to promote. We geofence around your service area to make sure not one marketing dollar is wasted. And then we message those people online with desktop display, mobile, video pre-roll, and social media ads that drive them to connect with your hospitals with just one click or tap. More on the digital capabilities in just a bit. We want to show you more about the health screening kiosks and how they work. So today, these completely free, completely self-service health screening kiosks are located in 3,600 retail pharmacy locations, like Janet mentioned. And those locations are within 10 miles of 79% of the population. Those are mostly Walmart stores, but there are also about 700 Safeway locations included in that number. And over the next year, Walmart plans to expand the kiosks into all of their locations, which means that very soon there will be even more locations in each of your service areas. And at that point, we'll be within 10 miles of about 96% of the population. Growth. The number of kiosks in your hospital service areas can really vary based on your location. So if you'd like to find out more about how many are located near you, we'll have an opportunity for you to email Janet after the webinar, and she can share the specifics of your area. The kiosk itself is an FDA-cleared Class 2 medical device that offers several screenings in a one-stop shop. The most popular test is the blood pressure test, and you can see it's taken by about 2.3 million people a month. But there's also really strong activity around the BMI test, the health age assessment, which is an HRA that was developed in partnership with the Cleveland Clinic. There's a type 2 diabetes risk assessment developed in partnership with the American Diabetes Association, a sleep health test, and more. So this is to show that the breadth of the screenings offered on these machines, that there's really great breadth. And because most users take more than one test per visit, we find that they spend a good amount of time engaged with the kiosk, about 3 to 4 minutes per session. And compared to most advertising environments, this is a fairly long time to have someone's full and undivided attention, which means we have a really unique opportunity here to present kiosk users with relevant and timely messaging from your hospitals. Now Janet's going to tell you about why the environment is so impactful.
Thank you, Stephanie. So for those of you who aren't familiar with the kiosks, this is a picture of how they look along with the different components. You'll see the digital sign on the top of the kiosk, which is on the left side, and then you'll also see the interactive screen that's right below it. So on the left side is the digital sign. So this is eye-level placement right above the kiosks that makes your campaign visible to not just people who are taking those healthcare screenings, but those who are just in the general area. So someone who's buying contact lens solution, someone who's picking up their prescription at the pharmacy, all of those, all that traffic you'll be able to leverage, and they'll be able to see your ads or your videos. This builds great awareness for your hospital, again, right in your service area. We can do static images and we can even do video on these digital signs. And then on the right side, you'll see the interactive user interface, and you'll see some screenshots there of kind of what the person sees as they're taking those healthcare screenings. There's, you know, banner ads that are on the bottom and the top. Then you'll see a full page ad or video that, you know, takes over the whole screen, and, you know, we'll be promoting your hospital. So the key thing to remember here is what we call the maximum point of impact. So just to paint a picture here, picture this. A person sits down at the kiosk and does a healthcare assessment, and they're told that they're at a high risk for a heart attack based on their weight, blood pressure, and other factors. So as that news is sinking in, they'll see a video or a banner ad about your hospital and its award-winning care. After they watch your ad, they're given the option to receive more information on how they can reduce your risks, and that'll all be sent from your hospital. They can opt in and get more information. So now you're reaching someone at what we call the maximum point of impact. How much more likely do you think they are to remember your hospital and take action right then and there versus seeing a print ad or an outdoor billboard when they're in a completely different mindset? Just think about that. And then once we have them in that mindset and they see the ad for your hospital, the user is able to opt in with their email address for more information. And that's how we're able to provide you with leads from the kiosks. As the saying goes, honestly, timing is everything. If you can reach people at the right time and in the right place, you've got a much, much better chance of conversion. And for those who are browsing the health and wellness area or picking up their medication at the pharmacy, they'll be able to see that digital sign that's at the top of the kiosk with your hospital's information and video. That's amazing brand awareness. And for those of you who have ever stood in line to pick up medication, you know you could be there for quite a while. So it's great frequency for you. They'll likely see your ad or your video 2 to 3 times while they're waiting, if not more. So it really kind of we do a really good job of kind of making sure that we reinforce your hospital, your brand, and that call to action.
For this slide, you can see a list of attributes that covers virtually all the questions that we have explored through the different assessments on the kiosk, which means you can have that maximum point of impact that Janet was talking about around several health conditions. If you want to promote a bariatric service line, we can set it up so that your ads only get served to someone who has high BMI. Or if your hospital has a sleep center, we can target kiosk users who snore, have disrupted breathing when they sleep. And every single user starts their session by giving their age, gender, and ethnicity. So we'll always be able to target based on those attributes. This page takes us away from the kiosk and back to the digital side of the platform. This shows how we use our proprietary database of opt-in, HIPAA-compliant health condition, ailment, and prescription data to find those needles in the haystack. People who have raised their hand and said, I have this issue, but maybe they're not at the place where they're actively searching for treatment. Maybe they have chronic knee pain and osteoarthritis, but they're not yet going to Google and searching for information on knee replacement. This is where we can really help. We identify these people with the ailment or condition your hospital can treat. We aggregate and anonymize the audience so that we're compliant with all privacy regulations. And then we find the sites that they visit online, as well as use Facebook to serve them messages and encourage them to act. That call to action can be a click to your website to learn more. We can send them to a landing page where they fill out a short form and you follow up with them later. We can even do a click to call so they can schedule an appointment right there on the spot. The digital plan for each campaign is customized based on the target you're trying to reach. And then as the campaign rolls out, we keep our eyes on the performance and find ways to optimize as we go, turning up the channels or ad sizes that have the most engagement and turning down the ones that aren't performing as well. So that'll ensure the best success for your campaign. And based on our past campaigns, I want to emphasize that this is really where the magic happens in the campaign, because we're able to really create a lot more frequency here. A user may only go to a kiosk once a month. They may only see the digital sign on top in the pharmacy once a week. But if they didn't respond to your ad while they were there doing the health assessments, we might not get the chance to see them again for a little while. And with this digital component, we can message them several times, and even if they don't act right away, we have many more chances to get in front of them and give them the opportunity to click or call. We always see the lion's share of the action and engagement and leads around the campaign coming from the digital side. So we just want to make sure we emphasize that.
So on this slide, you'll see just a few examples of sample audiences that we just created, just to give you an idea of how specific we can get. For those of you who have a digital team and are already doing digital targeting, I want to make sure that I point out the differences between our program and other digital targeting programs. Most digital targeting is based on online activity, behavioral, and demographic data. Our program really takes it 10 times further. We use those same resources to find an audience, but more importantly, we combine that with data related to prescriptions, ailments, medical history, and so much more. That allows us to find the exact person that you're trying to reach. Finding the exact person is the difference between serving ads to a 65-year-old suffering from arthritis versus a 14-year-old who recently Googled arthritis for a school project. Obviously, there's a big difference there. And by using that demographic data and medical data, we know that we're talking to the right people. So on the screen, you'll just see some of the examples of campaigns. And I want to bring your attention to, for example, if you wanted to promote your women's services, we can create a campaign that targets an audience that's women within a certain age range, that's had a pap smear within the last 3 years, that's due for a mammogram, that could be pregnant or planning their pregnancy, even as specific as knowing that they take specific medications, whether it's birth control, menopause, fertility medication. We have all that data, and we can find that exact person that you're looking for. I doubt that any targeting that you're currently using or doing can get that precise. And obviously, we can definitely target within any sort of service area that you're looking for. In short, we can really create a campaign for any service line, strategy, or event. It doesn't always have to be for a service line. It can be as broad as just doing for a specific event that you have coming up. So just wanted to share that so that you can have an idea of what the audience can look like, and it can just go as deep as you want us to go.
Here are two of our recent success stories. The one on the left was a campaign that we did for a hospital in Florida. They were looking to drive orthopedic surgeries in their off season, knowing that most people wait until the end of the year once they've met their insurance deductible to schedule a surgery like this. Well, for this one, we found people who were having pain and would be good potential targets for the program, but we didn't overlay based on high household income to find those targets who wouldn't be waiting to meet a deductible. They would likely self-pay for the surgery. And the campaign was a big success. The hospital saw a 464% increase in site visits over the 2-month campaign, and they were so pleased with the results that they followed up with a campaign for their bariatric service line, which just ended yesterday, and we should have more info on that one soon to see how it did in the next week or so. And then the example on the right, This was for a regional healthcare provider that was looking to drive mammogram screenings in underserved populations. The client had data indicating specific populations and geographies at risk for breast cancer based on age, ethnicity, and found that they were unlikely to have had a mammogram screening. We found that audience online, messaged them with ads driving a click-to-call message, and encouraged them to make an appointment. And this one was also a great success. More than 3,000 appointments were scheduled over 60 days. Beyond those appointments that were scheduled, they also collected more than 10,000 leads through the call center for further follow-up. This page is two sample packages. These are kind of our standard packages, package 1 and package 2. The big difference between them is the level of investment and the amount of impressions that are included. So in both scenarios, we'll be looking to customize it based on how many kiosks are in your area. The impressions that are included in the package would then be spread across all of the kiosks that are in your service area. And then they also come with that digital programmatic media piece. So that will also vary. The specs of the digital campaign will vary based on the target audience and the service line that you're trying to promote. But these are the standardized number of impressions, components that are included, and costs for 2 different levels of investment.
So on this slide, we added, because I'm sure if you're anything like the hospitals that I've spoken to in the last few weeks, you know, your wheels are probably turning already. So we created this slide to be helpful to you as you start thinking about when would be a good time for a campaign like this, you know, which the answer is anytime really, but oftentimes it makes sense to kind of piggyback on things that are already happening. So oftentimes national campaigns promote awareness of specific health conditions. So think of October in breast cancer and February for heart care. You know, these are national campaigns that puts people in a certain mindset. You know, you can piggyback on that national awareness of these healthcare holidays to create a campaign for your hospital. So on this slide, you'll see some upcoming dates, and I just added, like, you know, the next 6 months really. But you'll see some upcoming dates that could align well with campaigns. So for example, if you wanted to schedule a mammogram screening campaign for October, which is National Breast Cancer Awareness, you know, that's an option. And actually that's perfect if you've earned the Women's Choice Award for your breast centers. You know, what a great opportunity there to not only promote your award, but jump on the bandwagon that everybody's going to be talking about breast cancer around that time. Also, as I mentioned earlier, you know, these campaigns don't always have to be about your service lines. It can be for a community event. So for example, if you're having an event to promote your women's services, we can help you reach women in your service area who are within a certain age. They suffer from, you know, specific conditions. You know, they're due for a mammogram or an annual checkup. You know, we can find those women right in your area and, you know, message them with your upcoming event and have them visit, you know, if you're having a women's expo or anything like that. So, you know, it can be just to, you know, food for thought. This can be to promote service lines, events, campaigns, you know, anything that you like. So hopefully, you know, Stephanie and I have done a good job of giving you an overview of our program and how it can help you. This is really, really an exciting program that I hope you really all take advantage of, because I have no doubt that it could be a huge success. We couldn't wait to tell you about it, and hopefully you're excited about the possibilities and you know, your wheels are turning. I understand that a lot of times the killer of great projects and ideas are budgets. And so although budgets are always an issue, you know, when you think of the money that you might be spending on outdoor advertising or print ads or other campaigns, I would strongly encourage you to evaluate the results that your campaigns are currently having and see the results that you're receiving. If you're not seeing significant response and growth from any of these programs, you should strongly, strongly consider reallocating some funds and trying this program. I guarantee you that few programs can combine the brand awareness, email acquisition, and digital targeting into one campaign and get the results that we've seen. So, again, I know that, a lot of you have your budgets fixed or, but it's just as easy as pulling from one place and investing it in this, because I have, based on the success we've seen, we know that you'll get incredible ROI. And the bottom line is, honestly, if you don't take advantage of this program, your competitor will. We have seen amazing interest and, from hospitals about this program, not just to promote in their service area, but to take market share from other hospitals that are outside of their service area. So bottom line, if you don't consider this, somebody else will. So my information is on the screen, and you can always contact me for a one-on-one call, and we can discuss, campaign ideas. We can go over the kiosk availability in your service area and more. And actually, I'm seeing some emails coming through already, so that's great news. So with that, I want to thank you once again for joining today. We won't have time for the question and answer, but please know that we're noting all of the questions that are coming through from the chat, and we will be getting back to everyone. Also, the webinar recording will be available before the end of the week, and we'll make sure to send it to everybody who's on the call and everyone who registered on the invite. So we'll get all that information to you. But until then, you have my information there on the screen. So please feel free to reach out at any time. And thank you once again to everyone, and we will talk soon. Bye now.